Hello everyone, I am Dr. Audrey Tai. Welcome back to my channel, Eye Channel by Eye Surgeon. I'm a board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. I'm here to bring you the latest information on eye health and medicine. In today's video, I'll show you 3 different over-the-counter dry eye drops that I would not recommend to use to treat dry eye disease. If you want to know which over-the-counter dry eye drops I do recommend, you can find them in this video, my top 5 over-the-counter dry eye drops. I've also listed in the description below links to some of the eye drops that I recommend, so you can check them out. If you stay with me to the end of this video, I will tell you about one lesser known eye drop you may also want to look out for. Number 1. Soothe Maximum Hydration Lubricant Eye Drop by Bauchalon. The main reason I do not recommend this eye drop is the preservative they use in it. The preservative contained in this eye drop is benzalkonium chloride, or BAK. There are 3 different types of preservatives that are commonly used in eye drops: detergent type, oxidative type, and ionic buffering systems. The detergent type of preservative is the most toxic type to the surface of the eye, and BAK is the most toxic of the detergent type preservatives. BAK is also commonly used in many different types of medication eye drops, such as antibiotic eye drops, where its toxicity can actually be an advantage for short-term use. BAK can interfere with the connections between the cells on the surface of the eye and reduce the number of cells on the outer layer of the eye, called epithelial cells. Therefore, it can be quite harmful to the eye surface when used frequently or over a long period of time. If you really like the family of Soothe eye drops, you would be better off using the Soothe XP lubricant eye drops from the same company, as they contain polyquat as the preservative. Although polyquat is also a detergent type of preservative, it is less toxic than BAK because the cells on the surface of the eye tend to repel polyquat, making it less toxic to the eye surface. Even better among the Soothe family of eye drops are the preservative-free eye drops. If you would like to learn more about the science behind the ingredients of different artificial tears and why I would recommend certain artificial tears over other ones, you can check out my video about the science behind artificial tears ingredients. Anytime you do not have 10 minutes to watch videos, you can watch short fun videos about eye care tips on Instagram at Dr. Audrey Tai. Number 2. Clear Eyes Natural Tears Eye Drops by Prestige Consumer Healthcare. There are 2 reasons that I do not recommend using Clear Eyes Natural Tears for treating dry eyes. The first is that this eye drop also uses benzalkonium chloride, or BAK, as its preservative, and there's no preservative-free version of this eye drop. The second reason is that this eye drop contains polyvinyl alcohol, or PVA, which is a demulcent that lowers the viscosity or thickness of the eye drop. PVA is found in many older types of artificial tear eye drops. There are more effective newer compounds that are available as a demulcent in eye drops, such as propylene glycol and polyethylene glycol, which are used in some newer artificial tear eye drops. You can find links to some example of the over-the-counter eye drops for treating dry eyes that contains the newer demulcents in the description below. I hope you have found this video helpful so far, and if so, please consider hitting the like button and subscribing to my channel. It will really help me to bring you more videos about eye health and eye surgery. Number 3. Visine Dry Eye Relief, Visine Red Eye Hydrating Comfort, and Visine Red Eye Total Comfort by Johnson & Johnson. Visine Red Eye Hydrating Comfort and Visine Red Eye Total Comfort contain tetrahydrozoline to reduce eye redness. Tetrahydrozoline is a chemical that temporarily constricts the blood vessels on the eye surface to reduce the appearance of eye redness. Frequent and long-term use of tetrahydrozoline can cause rebound dilation of the blood vessels on the eye surface when the eye drop is discontinued. This means the eye will appear red if the eye drop is discontinued. Now, unlike Visine Red Eye Total Comfort, some other Visine eye drops, like Visine Dry Eye Relief, do not contain tetrahydrozoline. However, all 3 Visine eye drops I mentioned use BAK as their preservative. And as always, I recommend avoiding long-term use of any over-the-counter eye drops that contain BAK due to its toxicity to the surface of the eye. If you really would like to choose an eye drop from the Visine family to treat dry eyes, you would be better off choosing Visine Dry Relief Tired Eye Lubricant Eye Drops or Visine Dry Relief All Day Comfort. As the preservative used in those 2 eye drops is polyquat, which is less toxic than BAK. Thank you for staying with me this far. As promised, I'll mention one more over-the-counter eye drop that I do not recommend for treating dry eyes. Roto Cooling Eye Drops DigiEye. It is less well known than the other over-the-counter eye drops that I have reviewed in this video. However, I decided to bring your attention to this drop because of its eye-catching package, which was the reason I noticed it on the pharmacy shelf. DigiEye contains both tetrahydrozoline and BAK, which, as we already talked about, can be toxic to your eyes. Let me know in the comments below which of the eye drops I mentioned in this video surprised you the most. If you have been using any of those eye drops, would you consider switching after watching this video? You can also find links to some of the over-the-counter eye drops I do recommend for dry eyes in the description below. I hope you find this video helpful. If you have learned anything new, please don't forget to hit the like button and subscribe to my channel. Because if you click that subscribe button, you will help give me the opportunity to continue to bring free videos about eye health and eye surgery to the world. You can also follow me on Instagram, Facebook, and LinkedIn at Dr. Audrey Tai to learn more about my practice. I look forward to connecting with you there. Thank you again for watching, and I will see you in my next video.